Guam is officially out of the Omicron surge, as territorial epidemiologist Dr. Pobutksy shared the latest data in the island's battle against COVID-19 from January 1st to May 10 of this year. The 7-day rolling average is now less than 30 cases per day, and a continued decrease in COVID testing, with the test positivity rate now under 5%. The island-wide COVID-19 hospitalization ICU count continued to decline, but deaths continue to appear occasionally. Also, most cases in the past 28 days are residents who are asymptomatic. Dr. Pobutksy also shared an explanation on the dead on arrivals the island saw throughout the pandemic. The 5-year dead on arrival average from 2015 to 2019, before the COVID pandemic, was 30.7% for all deaths. In 2020, during the Alpha surge, Guam saw 23 DOAs out of 126 COVID deaths, bringing that average down to 18%. But during the Delta surge, that spiked.
So Guam normally sees a lot of people who are dead on arrival because a lot of people just die at home. We don't have long-term care facilities. We only have the one nursing home and a hospice. So most people die at home. But what we do see, and during the surge in 2021, which was Delta, this jumped up. The COVID-related dead on arrivals were 37%. And then during Omicron, it was 44%.
During the Delta surge, the island saw 55 DOAs out of 148 COVID deaths, and in the Omicron surge, it was 36 dead on arrivals out of 81 COVID deaths, with most deaths being the elderly and those with comorbid conditions. Dr. Pobutksy confirmed that the DOAs were more than usual, and it was because of the COVID pandemic.
We did see those spikes in dead on arrivals. We now have the numbers to show that this is higher than normal, specifically for the COVID-related deaths. What we found also is that a lot of the dead on arrivals, most of them, got tested the same day they died, so they didn't even know they were sick.
Dr. Pobutksy added that when the three surges hit, specifically Delta and Omicron, it put the elderly and those with comorbidities at risk, since most residents live with multi-generational families in multi-general homes. Public health continues to urge vaccinations and boosters as the main defense against the virus. Those with comorbidities and the elderly should continue to take precautionary measures, since they are the most vulnerable to catching the virus. Daniel Perez reporting for KUAM News.